Hi, everyone. My name is Blake Cadwell. I'm a hearing aid wearer. I'm also the co-founder at soundly.com, and I'm joined by audiologist Dr. Amy Sarow today. We're going to be talking about cochlear implants. And specifically, we're going to cover some of the sort of frequently asked questions about the topic. We'll talk about how cochlear implants work, who should consider them, which medical professionals you might speak to about this procedure, and what recovery and success rates look like, if you do decide to move forward with a cochlear implant. So it's important to note that while I am a hearing aid wearer, I do not wear cochlear implants, and I don't have an in-depth knowledge of this topic, but fortunately we have Dr. Amy here who does have an in-depth knowledge of cochlear implants and can answer some of our questions. So maybe we can just start with the basics. Dr. Amy, can you share what a cochlear implant is and sort of how it works?
Definitely. So a cochlear implant is a surgical way of hearing, surgical intervention, where we're going in and the part of the inner ear that is damaged, we're actually bypassing that and going directly to the hearing nerve. So it's sending a signal. You can think of it like a radio tower. There's a part on the outside that looks like a hearing aid, and it's actually a speech processor that's connected to the head. And then there's a magnet that sends a signal to the internal portion that is surgically placed behind the ear. And then that sort of transfers like a radio tower. And those signals are then sent to the hearing nerve up to the brain. So it's a way that we can create a system where we can bypass the damage and help a person who is not able to receive sound acoustically in a useful way and get them that information in a different way that they can use.
That makes sense. So for someone who is considering cochlear implants or maybe isn't familiar, can you give us a sense for who would typically be a candidate for a cochlear implant, and kind of for this setup as compared to maybe a traditional hearing aid?
So a traditional candidate for a cochlear implant is going to be somebody who no longer benefits from hearing aids. And just to give you an idea, we use the 60-60 criteria, which I won't go into all of the details with that. But essentially what it means is an average conversational level is about 65 decibels. So somebody who is not really perceiving average speech without visual cues, that person is probably going to be a candidate for a cochlear implant, or potentially could be. And if they've worn hearing aids for years, let's say their hearing has worsened over time, they've, had adjustments to their hearing aids, it's just not benefiting them in the way that it used to, that person could consider a cochlear implant.
That makes sense. And I know in our conversations, we've talked about how, some folks maybe have misconceptions about cochlear implants and the amount of benefit that they can get from them. And even some, I think we've seen some folks on the soundly.com site asking, are these, supersonic hearing? Is this the kind of the top end or the highest level hearing? Maybe you can speak to that briefly and sort of what folks can expect on that front.
Certainly. So there are sometimes people will come in and let's say they have mild hearing loss or they have hearing loss and they're wanting to get, that supersonic hearing. So they say, well, would I be a candidate for a cochlear implant? This procedure is different than if, let's say, if you get LASIK surgery on your eyes or something other than that, So this is really an involved process. You're going through a surgery, you're going through a period of recovery. And so we want to make sure that people who are doing this, they're going to truly benefit from it. So unfortunately, we don't have the technology just yet where we can give you supersonic hearing. So that would not be somebody who's really a candidate for this type of procedure.
That makes sense. Okay, so I guess with that out of the way, maybe we can talk about if you do decide to move forward with a cochlear implant or receiving a cochlear implant. Can you talk a little bit about the success rate? How successful do these surgeries tend to be, and how often do folks find that a cochlear implant is working for them after they've gone through the process?
Well, that's a great question. And there's two sort of categories to talk about here. So there's the surgical outcome aspect, which nowadays cochlear implant procedures are very safe. Um, a surgeon is going to evaluate you prior to the procedure to make sure that you're healthy enough for the surgery. You'd be under anesthesia. It usually takes a few hours. Most people are able to leave the same day, so within a few hours of the surgery. Now, so those outcomes are very good. So we see just a small percentage of people having some type of complication. And obviously, the surgeon goes over all of that with you prior to that. So that is all very optimistic in terms of those outcomes. Now, in terms of performance outcomes, that's a little bit different story. So we do see a variety of outcomes with cochlear implants. Some people are superstar performers. They get the procedure and they're doing amazing. They're understanding in background noise. And other people, they have it as a supplement to lip reading. It really depends on your history. So a different person's history, let's say they've had long-term hearing loss for many years, that's going to be different than someone who's had a more sudden change to their hearing or, Meniere's disease, other types of medical history. That's all going to contribute to how you do, as well as how much effort you put into the oral rehabilitation process, because that is a process where you have to be actively engaged as well. And there's other factors too, but that can look different for different people.
Yeah, that makes sense. So if someone does choose to go through with the procedure and get a cochlear implant, you talk a little bit about the sort of recovery portion, and you mentioned some of this around the rehabilitation portion, but what can someone expect after their surgery occurs and after they now have a cochlear implant?
So after surgery, there'll be some time where you'll have a bandage on the head and you'll go to see the surgeon afterwards, and they'll just follow up to make sure that that incision is healing properly. In most cases, when I talk to patients after the procedure, some of them have a bit of a headache or something where, there's some swelling for a few days. Most people do pretty well after the procedure, actually, but the physician will work with you to make sure you're comfortable with that portion of it. Then there's a period of about 4 weeks from the time the surgery happens to when we would activate the cochlear implant, which means you're not going to wake up after that surgery and hearing will suddenly be better. Actually, it will be about the same, perhaps slightly worse after the surgery. It's not until we activate the cochlear implant that you're able to hear or perceive something on that side. That being said, on the day of activation, the sound is not going to be crystal clear and, just what you're going to expect or experience throughout the year of learning with that new ear. So it's going to take some time. At first, when we turn it on, voices might sound like Mickey Mouse. It might just sound like noise. And then every day, every week, it's going to get a little better. And you'll want to be practicing. So you could read books out loud to yourself or have family members do that. And we'll give you practice exercises that you would do. Over time, it will get better. And we expect that your peak performance is going to happen at about 6 months to a year after we do that first activation. And then in background noise, it can even continue to improve a bit beyond that. But that would be kind of a typical experience.
That's incredibly helpful. And I think this is where, folks who have experienced hearing aids maybe can draw some parallels. I know, when I put on hearing aids for the first time, the sound didn't feel as natural. And then over time, the brain learns and to take that in and adjusts to it. And obviously the cochlear implant is different, but similar logic in some ways. So obviously we're describing a fairly involved procedure, a number of different moving parts. Can you talk to us about the team and sort of the medical team that would go through this process with you? Who would you even reach out to in the beginning to start the process of getting a cochlear implant if you were interested?
Certainly. So there are a few people that you could reach out to start this process. Now, if you live in a larger city, you may be near a hospital clinic or a neurotology, an ear clinic that specializes in this type of surgery. And of course, you can reach out to them there. If you're not sure who to reach out to first, you could start by reaching out to one of the cochlear implant manufacturers. So that would be Cochlear Americas, Advanced Bionics, or Med-L. So those are the three main cochlear implant manufacturers. And each of them would be able to connect you with someone who can answer your questions, or they can even set you up with someone who's been through the whole process, a mentor, so to speak. And I know with Cochlear Americas, they do try to match you with someone who's, a similar age, maybe similar life experience, so that they can relate to you and they'll be able to answer your questions, which is really nice. And that's also no pressure. So you can talk to that person. They'll be able to answer questions for you about what the process was like, what to expect, what their real thoughts are about everything. And then if you feel like you're ready to take the next step, they can help set you up with a clinic where you would be evaluated. And then from there, you can find out if you are a candidate first. And then if you decide to go forward with that, you would speak with a surgeon, surgical team. They would evaluate you, your health for surgery, and it would go from there.
That makes sense. Well, this has been incredibly helpful, I think, for the folks watching. We hope that this gives you some information to continue your research and your search if you are considering cochlear implants. We do have some information on soundly.com about cochlear implants, and as Dr. Amy mentioned, you can reach out to some of those leading manufacturers to get even more information or be connected to someone who has gone through the experience firsthand, which I think is an incredible resource. So thank you, Dr. Amy, for your time today, and to you, the viewer, thank you for your time, and we wish you the best in your search.